Hi, I'm Dr. Arul Furtado, a cardiothoracic surgeon at Aster CMI Hospitals, Bangalore. My areas of interest include minimally invasive and robotic heart and lung surgery, aortic surgery, and hybrid cardiac surgery. Today, I'd like to talk to you about aortic pathology and how often it is misdiagnosed. This is about a gentleman in his 70s who presented to us about 2 to 3 days after a fainting episode at home. Prior to this, he had an episode of retrosternal chest pain right here. He recovered, presented to our ER about 2 days later, and given his history, he was being worked up for what most people think has gone wrong, a heart attack. Our team was quick enough to realize that that was not what they were looking at and did further investigations. And lo and behold, to our surprise, we found that he had an entity called an arch aneurysm, which had sort of ruptured and was leaking into his left chest, a life-threatening condition. So what happens is that when a patient usually comes to us with chest pain, what usually comes to our mind is a heart attack or what we call a myocardial infarction. This happens to be true in most cases, but there are ways and means by which a heart attack is ruled or negated out. In such situations, people should be aware of certain other pathologies that can cause similar symptoms. One is an entity called aortic dissection, wherein the blood vessel that carries blood out of your heart splits into layers and starts leaking. Another is an entity called pulmonary embolism, where a blood clot goes to the blood vessels that run to the lungs. And another is an entity called a pulmonary infarction. Of these, pulmonary embolism and an aortic dissection are as life-threatening as a myocardial infarction. So this particular gentleman was stabilized, and the entire cardiac surgical team, along with cardiology, did a procedure called a debranching of the neck vessels, followed by a stent graft insertion to deal with this aortic aneurysm. He continues to be on follow-up and is doing well.